Good morning, everyone. Today we're going to learn how to diagnose a pneumothorax, which is air in the pleural cavity. Let's start with the clinical presentation.
Before we start, Dr. Hassan, could you explain what typically leads to a pneumothorax?
Yes, and how common is this condition in a trauma patient?
We must look for clinical signs and symptoms of pneumothorax in every case of suspected chest trauma. Patients involved in a high-energy trauma must have pneumothorax ruled out, as it is very common in such cases. We can't afford to miss that.
What symptoms should we look for, Dr. Hassan?
Good question. Patients typically present with history of chest trauma, sudden onset chest pain and shortness of breath.
And what signs should we be looking for?
Physical examination can give us important clues. They might also have a rapid heart rate and, in severe cases, hypertension and engorged neck veins.
What specific physical signs are definitive for diagnosing pneumothorax?
First, we'll inspect chest for bruising or swellings that may indicate chest trauma. Then we'll inspect if chest expansion is bilaterally symmetrical or not. Then we'll inspect neck for any engorged veins, palpate to see if trachea is central, then we'll do percussion.
What are we expecting to find on percussion and auscultation in a case of pneumothorax?
Any area of hyperresonance is suggestive of pneumothorax. Then on auscultation of the patient's chest, listen for diminished or absent breath sounds on one side, which indicates the possibility of a pneumothorax.
That is very interesting. So hyperresonant percussion note and diminished or absent breath sounds are diagnostic of pneumothorax.
But what's next if we suspect a pneumothorax based on clinical examination?
We confirm our diagnosis with imaging. The most common initial test is a chest X-ray.
What will we be looking for in a chest X-ray?
On the X-ray, look for the absence of lung markings and a visible pleural line. The area beyond this line will appear more radiolucent because it's filled with air rather than lung tissue. And remember, if the patient is in severe distress or if there's any hemodynamic instability, treat immediately as a tension pneumothorax, which is a medical emergency. Always correlate clinical findings with imaging and remember that timely intervention can save lives. Any questions, or should we go see a couple of X-rays of patients with pneumothorax?
That was very clear. Thank you, Dr. Hassan.